Lower back pain is the #1 cause of pain and disability on the planet. This condition affects hundreds of millions of people around the world. And if you're one of those people and you're interested in simple strategies that you can use to improve your situation, then there's a fascinating research study that was just published in May of this year that you need to know about. The paper that I'm referring to is this systematic review that was published on May 28th in the journal BMC Musculoskeletal Disorders. These researchers analyzed 54 different studies with the specific aim of understanding the role that the hip joint plays in non-specific low back pain. After sifting through and analyzing this mountain of data, there were a couple of key takeaways that these researchers identified in terms of the differences between the hips of people who suffer with lower back pain and asymptomatic individuals. And those were, #1, people with lower back pain tend to have much stiffer hips. Now, this is far from a revelation. We've known for a long time that lower back pain is associated with less total range of motion at the hip. But these researchers pointed out that there are two movements specifically where people with lower back pain really tend to struggle, and those are hip internal and external rotation. And the second key finding was that people with lower back pain have significant deficits in muscular strength in two regions in particular. And those are the hip abductors and the hip extensors. What I want to do now is show you a simple, targeted 3-part routine for addressing the movement and strength deficiencies that are most commonly associated with low back pain. Step #1 here is to get better at rotating your hips, both internally and externally. And my favorite movement for accomplishing that is called hip flips. To perform hip flips, you'll start off in a side sitting position like this, with both knees bent to about 90 degrees. One leg is out in front of you, the opposite leg is tucked behind you. Beyond that, you want to make sure that your spine is nice and long and that your abdomen is engaged to keep you stable and to prevent you from falling backward in this position. Okay, you want to be upright here. Then from here, starting with the right hip in deep external rotation and the left hip in deep internal rotation, we're going to reverse the position. Starting from the abs, making sure that your spine stays long the entire time. Upright spine, switch. Internal rotation, external rotation. Basically what I'm trying to do is touch the inside of my right knee to the floor and the outside of my left knee to the floor, and then reverse that. Switch over to the opposite side, back and forth, keeping the spine nice and long the entire time. Now, if you find that this position is too difficult, too hard on the hips or too hard on the knees, or you just don't have enough mobility to be here, what you can do to make this motion just a little bit easier is to bend the knees less. So instead of a 90-degree bend, if you go to like a 45-degree bend, then you can see the exercise is a lot less extreme. Less range of motion is required. You're still working on keeping that upright spine, but you don't have to move the hips and the knees through nearly as much range of motion. So that can be a nice way to start. If that's still too difficult for you, I've got an easy way to solve that. For anybody who struggles with seated hip flips, there's a modified version of this exercise that is much, much easier. To perform that, you'll go flat down on your back. Again, it's helpful if you've got a little bit of cushioning underneath you. Head should be in contact with the floor, neck should be completely relaxed. I like to have my hands resting on my abdomen. From there, you're going to make sure that your knees are bent to about 90 degrees and your feet should be positioned wide apart, about 2 to 3 feet of space in between your feet. And then from there, what you're going to do is try and touch the outside of your left knee and the inside of your right knee down to the floor while keeping your shoulders in contact with the ground. Slowly bringing the left hip into external rotation and the right hip into deep internal rotation. Hang out for a second or two and then slowly reverse it. Try to touch the outside of the right knee and the inside of the left knee to the floor. And again, we're trying to keep the shoulders flat. We don't want the body rolling over as we rotate our hips. We want most of the motion occurring in those hip joints. And then back and forth, just like that, keeping the shoulders flat, internally and externally rotating both hips. Should aim to perform 20 to 30 total repetitions of this exercise. Step number 2 is to begin building strength in the hip abductors and hip extensors. One of the simplest and most effective ways to start building strength and stamina in the hip abductors is with side-lying leg raises. This exercise doesn't require any equipment whatsoever. All you need is a comfortable surface to lie on. Once you've got that, just go down on your side. I'm gonna be starting with my right side down. I like to have my right arm tucked up underneath my head like this. This helps to keep my neck in a neutral position and allows my head to stay completely relaxed. I also like to have my up hand, in this case my left hand, out in front of me like this, palm down, to help keep me stable and prevent me from rolling around as I go through this movement. Legs are going to be extended straight out. I like to have my top leg, in this case my left leg, draped just behind the down leg. This pre-stretches the hip abductors and gets them ready for a maximal contraction. And from there, lightly brace the abdomen, drive the right hip into the ground for stability, and then slowly begin squeezing those left hip abductors, raising that left leg up as high as you can to the sky. As you're lifting up, you also want to be aiming about 5 to 10 degrees back behind you. This is going to help really engage that glute medius, the muscle that's doing most of the work here, maximally. Hold for 1 to 2 seconds at the top, slowly down, controlling the leg the entire time. Drape the top leg behind the bottom leg, stretch, squeeze, up, slightly back behind you, squeezing that glute medius, slowly back down. Now you can start with whatever amount of repetitions is challenging for you on this exercise, but eventually you should work yourself up to the point where you can perform 30 continuous, slow control repetitions on one side, switch over to the opposite side, and repeat. For building up that base level of strength in the hip extensors, we're going to be using a very straightforward and simple exercise called hip up and hold. The only thing that you're going to need for this is an exercise ball or a sturdy chair or couch, something that you can put your feet up on that can support a little bit of weight and not give out on you. Once you've got that, just go flat down on your back, directly in front of your ball or your chair. Feet are going to be positioned on top of that surface. Head is going to be resting on the floor. Neck should be completely relaxed. Hands should be positioned off the sides of your body about 10 or 15 degrees, palms down. This is going to help give you a little bit of extra stability and support as you go through this movement. And from here, maintaining about a 5-degree bend in the knees. So you don't want to be completely locked out. You want to have just a tiny bit of bend there. You're going to lightly brace your core, flatten your back to the ground, and then begin squeezing your rear end, allowing that squeeze to push your pelvis up to the ceiling. That's the only thing you should be focusing on, is squeezing your rear end. Then you're just going to hold that top position for 20 to 30 seconds continuously, focusing on the squeeze, not allowing your body to dip at all. Squeeze hard. That squeeze is the only thing that's holding you up. At the end of 20 to 30 seconds, slowly lower yourself back down to the ground. By relaxing the squeeze in your rear end, you're going to maintain the light bracing of your core the entire time. And then you're going to rest for an equal amount of time to the time that you stayed in the top position. And then you'll repeat 1 to 2 more times for 2 to 3 total sets of this exercise. So there you have it, 3 super simple but highly effective ways to address the 2 most common hip issues associated with the most common diagnosis of lower back pain on the planet. Thank you so much for watching. If you enjoyed this video and you got something out of it, make sure to hit the like button and the subscribe button before you head out of here, and I'll see you next week.